The Affordable Care Act also calls for an expansion of Medicaid eligibility to all citizens under 133% of the federal poverty level, and Governor Quinn supports this expansion in Illinois. We expect that to result in an additional 500,000 people qualifying for Medicaid in Illinois beginning in January of 2014. The Affordable Care Act also calls for states to establish a benchmark plan for newly eligible Medicaid population. So over the next few months, we will be engaging stakeholders and determining whether to offer a benchmark plan for Medicaid that is modeled after private insurance, because there will be many people in this new population that will transition between an exchange and Medicaid, or whether it should be something closer to a traditional Medicaid benefit. Now, most of you, probably all of you, are aware that we fought hard this past spring to pass the SMART Act, which reduced the Medicaid program by $1.6 billion. This was a step that we had to take because we knew that if nothing was done, the Medicaid program would have over $2.7 billion in unpaid bills by the end of this fiscal year and over $20 billion in unpaid bills by the end of 2020. Looking ahead, we also knew that we had to make changes to the program to plan for rising healthcare costs due to the aging population in Illinois. So the question is, why does Governor Quinn support an expansion in Medicaid eligibility when we just worked so hard to cut the program? First, because the federal government will pay 100% of the costs for this new population for the first 2 years, phasing down to 90% thereafter. This will bring in billions of federal dollars at relatively little state cost and provide needed services to a population that has been underserved for far too long. This population costs government, whether they are officially covered or not, through uncompensated care, emergency room visits, and crisis care services. We believe this expansion will save the state money by providing federal match for services that we are paying for with state dollars now, particularly mental health and substance abuse services, and by improving long-term outcomes. Second, this expansion would occur in the context of our overall Medicaid reforms. We will not be dumping new enrollees into an unsustainable fee-for-service system. With a new emphasis on coordinated care and innovations in healthcare delivery, we believe that we can provide coverage for the newly eligible as well as the existing population in a better way that improves outcomes and reduces long-term cost growth. And we also view this as a social justice issue. Since coverage and premium subsidies through the exchanges are mandated in the Affordable Care Act, the Supreme Court decision last June leaves the lowest income population as the only group that does not have guaranteed access to health coverage. We do not want a situation in Illinois where those above 133% of the poverty level have access to coverage through premium subsidies, but those below 133% are left with nothing. So since Medicaid eligibility and benefit packages are in statute, we need legislation to implement the expansion during this veto session. It has to be now because we need adequate implementation time to make the changes necessary in the Medicaid system and in our IT systems and in the provider network, quite honestly, to prepare for these new enrollees. However, given the budget situation and the politics around the Affordable Care Act, we do not expect this to be an easy lift. Again, it will take a lot of leadership and a lot of advocacy to get this done, and we are counting on help. So although I was asked to focus on the veto session today, I want to mention a few other of the governor's priorities that I want to make sure you're aware of. One of the first things Governor Quinn asked me to do when I joined his administration was to work on fighting hunger. He appointed me to co-chair the state's Commission to End Hunger with my co-chair, Kate Mayer. And I know Janine Lewis was on the panel earlier, and she also serves on this commission with us. I am very passionate about this issue because food is one of our most basic needs, and the lack of it contributes to so many other of our problems. Hunger is a health issue, it's an education issue, it's a violence issue, and it's an issue that can be solved. Working in state government, and I've actually been in government for a long time, I work on so many issues that are complicated and intractable, but hunger isn't complicated. People do not go hungry because there's no food. Food goes to waste every day in this country. People go hungry because we have not figured out the best way, the most efficient way, the most effective way to link them to the food that is available. I am extremely proud of the Commission to End Hunger and the people, the commissioners who are on it, who honestly do the majority of the work, because they have made real progress on this issue. This summer, we launched a partnership with the Share Our Strengths No Kid Hungry campaign. No Kid Hungry is a nationwide initiative to end childhood hunger. Through this partnership, we funded summer feeding programs and launched a school breakfast challenge to encourage more schools to adopt breakfast in the classroom and other innovative strategies so to make sure that children are fed. We will be doing more to address childhood hunger and hunger among vulnerable and underserved adults in the coming year. And I actually believe that the Commission is hosting a school breakfast summit next month. And then as a state, we also launched the Illinois Fresh Food Fund in July. The Fresh Food Fund was championed by Senator Jackie Collins and included in the Illinois Jobs Now capital bill. It will leverage $10 million in grants and low-income loans to bring grocery stores into food desert areas. The fund is being administered by IFF with oversight from our Department of Commerce and Economic Opportunity. In addition to increasing access to fresh foods, there are also educational and community engagement components, because we know that we can bring fresh food into these areas, but we also need to help people understand how to cook, how to shop, and how to actually take advantage of this opportunity, because we want the stores to be successful and we want the neighborhoods to be successful. So please let me know of any grocery store operators or any community organizations that you know of that might be interested in this fund, because it is something that we're taking applications, well, the IFF is taking applications for now, and we want to recruit good projects. We are very concerned about violence in our state and the toll that it is taking on our communities. That is why Governor Quinn launched the Neighborhood Recovery Initiative. It is a first-of-its-kind program designed to address the risk factors associated with violence. And I want to thank the ILAACP and many of you in this room who I know are partners with us in the NRI and in the Choose Respect anti-violence initiatives. The governor has also been a champion in fighting gun violence in Illinois. He fought against a concealed carry law in 2011 and used his mandatory veto to propose an assault weapons ban this summer. The General Assembly is not expected to accept this mandatory veto, and advocates are working with us to help support passage of an assault weapons ban either this veto session or in the spring. We also expect concealed carry to continue to be an issue in the coming year. The Seventh Circuit Court is expected to issue a ruling supporting the right to concealed carry. And many of you probably know Illinois is the only state in the nation, the last one left, that does not allow concealed carry. We expect legislation to be proposed shortly after that decision comes down for concealed carry law in Illinois. And it is important that all of us who are concerned about guns in our communities pay attention to this issue and help to shape what such a law would look like if one were to pass. Finally, I would be remiss if I did not talk about budgeting for results, which is a law that the governor signed in 2010 and one that I have been involved in working on. BFR is designed to provide more transparency and more accountability in the budgeting process. Under budgeting for results, we establish measurable statewide outcomes in each of 7 result areas, and those areas are listed on this slide. And these areas represent the primary functions of state government. Then funding decisions are based on the performance of programs in helping to achieve those statewide outcomes. Now, in the next phase of budgeting for results, throughout the end of this fiscal year, we will be focusing on finalizing these statewide outcomes and mapping how state agencies and programs contribute to those outcomes. As BFR is fully implemented over the next few years, we will be able to use common outcomes to benchmark program performance, identify best practices and efficiencies, and ultimately to allocate budget resources. In 2014, we will develop and standardize common performance metrics for all of the statewide outcomes. These measures will be research-based leading indicators of a program's contribution to the desired outcomes. Our Office of Management and Budget will validate these measures with state agencies who will be working with the providers in order to ensure that they are practical and relevant. Once these measures have been finalized, we will collect baseline data on all the programs. We will also work with all state agencies to set performance targets for each of the measures that relate to their programs, which will enable us to evaluate the expected return on investment in various outcomes and make informed budget decisions based on relative contributions to priority outcomes. And then in 2015, we will have more robust data on program performance and more refined performance measures. The state will also be in a position to evaluate agency budget requests based on these comparative benchmarks and their performance toward contributing to the outcomes. Now, I know I'm talking a lot about performance evaluation and return on investment, and we've done a lot of work and had a lot of conversations about this over the past year and a half. And we recognize that state spending decisions cannot and should not be made based solely on performance evaluation or return on investment concept. There are inherent value judgments that have to be made when deciding what programs to fund and what things to invest in. The purpose and the value of budgeting for results is in providing data necessary to inform these budget decisions and to help measure the effectiveness of different programs and strategies in achieving the priorities of the state. So, as you can tell, budgeting for results is something that I'm excited about, but also something that has implications for every aspect of state government. And therefore, I encourage all of you to be engaged and to be tracking this implementation. There are several ways to be involved. There is a Budgeting for Results Commission that will be meeting every other month starting in January. Previously, it has met every month, but they've recently agreed to an every other month schedule. The BFR Commission meetings are open to the public. The Commission also issues an annual report, which is due November 1st, which tracks implementation of the Budgeting for Results initiative and makes recommendations on how to improve the budgeting process. The report is available on the BFR website, which can be accessed right now through our budget website, which is budget.illinois.gov. The Commission also conducts public hearings each year to give stakeholders an opportunity to provide input. These hearings were held this year in Chicago, Springfield, and Carbondale. Next year, the Commission plans to have more hearings and have them spread out more evenly throughout the year and to have them in more locations and different times. In addition, our Office of Management and Budget is working on a more user-friendly public-facing website that would be modeled after the Virginia Performs website in order to engage the public on BFR and to be more transparent and make sure people have access to our performance metrics and information about the performance of programs and agencies. And that ends my presentation. I hope I've given you a better understanding of what the governor's priorities are going into this veto session and beyond, and hopefully that you'll be able to support some of these efforts to move Illinois back to fiscal stability. And I have my contact information here if any of you want to reach me to ask questions, and I'm also available here for a few minutes to ask questions now.
Cristal, I have a question that I'm sure the audience also has a question. We've been following this Budgeting for Results Commission work.
Sure.
And, one of our core values, of course, is accountability. We believe that the investments being made in our community require, on the part of our providers, some intentional, thoughtful, evidence-based approaches, right, to improving the quality of life in our community. And oftentimes, I think, organizations get caught up in process outcomes. I handed out X number of flyers, or I did this, but not really, at the end of the day, because of those processes, what was the end result, right? Did that young person get a job? Were they able to get off their diabetes medication? So the list goes on and on. At the same time, having said that, we do have some concerns that this new process is rolled out to our community, but our community is not prepared. When I say our community, our providers in our community are not prepared. And as a result, there's a threat in their mind and rightfully so, that they could be cut.
Yes.
So can you share with me any plans or any discussions that are in place as to how this process will be rolled out?
Sure. I can share with you discussions. I cannot share with you plans yet. But that is something that is very much forefront in our minds and talked about a lot in our Budgeting for Results Commission meetings. We recognize that there is that need, and that budgeting for results cannot result in certain providers getting cut just because they do not currently have the capacity to collect the data or to do the evaluations that we're talking about. And that's part of what I meant when I said, was talking about value judgments as well. So, one of the recommendations, one of the strategies that we are pursuing is to develop that plan to make sure that we are helping providers create the capacity that would be needed to comply with whatever is going to be required under budgeting for results. So that's one, and we're engaging the foundation community. We're talking to the Chicago Community Trust as one, and they actually are represented on our commission, but we're reaching out to others as well because we understand, and I think there are a lot of people, fortunately, who understand that there is that need. People are very supportive of budgeting for results, but also recognize that that's not something that can just automatically happen, that we have to lay the groundwork and the foundation for that to be successful.
So you guys are committed to reaching further into the community because
Yes.
I know who's representing the trust,
Mm-hmm.
and I know who's representing Shriver, but one of our critiques of that was that they don't necessarily represent those that are on the front line.
Yes.
So there are no providers on this commission
Right.
now, okay? No providers.
Right.
These are folks that work in policy, which is great, but I think some further outreach to the communities needs to take place.
We do, yes, we do absolutely plan to reach further into the community, and we absolutely, have heard, that critique and that concern that there are no providers on the commission. And I have to be honest that there are no direct stakeholders of any of the 7 result areas on the commission, because that's not the work that this particular commission is doing. Having said that, we recognize as a state and as the implementation, as a member of the implementation team that's working to roll this out, that type of outreach is absolutely needed for the Human Service Committee as well as for stakeholders and contractors and providers in all 7 of those result areas, and that work is going to be happening.